These are document requests, not interrogatories. This is such a basic, well litigated area of the law that is shocking that a sitting senator is not intimately familiar with its limitations. The governor's communications director suggested that he send a proper FOIA request, and DOA will respond. And we're now going to head into the Zoom room where we have the chair of the governor's physicians advisory group, Dr. Hoa Nguyen. Good morning, Dr. Hoa.
Good morning, Sabrina, Chris. Good morning.
So have you been busy?
We've been very busy. I tell we do a lot of tests in the past week or so, and there's quite a few positive coming back, and it's a big concern that for our island. What we come out with this thing is that our people need to really go back to the basic of wearing the mask and kind of stay away from sick patient.
Yeah, that's kind of what the governor said during her Instagram video released Saturday night at 9 o'clock about going back to basics, wearing a mask, watch your distance, wash your hands.
We have some history that I think the fully vaccinated people need to understand that if you're fully vaccinated, you about 94%, 95% protection from getting the virus. But if you not be careful and you go around sick people, unvaccinated sick people, and have no mask on, you're still going to get sick. And that's what we see is that the fully vaccinated people become more careless now because they think that they're foolproof and they're not going to get infection. And that's the problem. So I'm going to ask everybody, especially the fully vaccinated people, to can still protect yourself by not going around sick people without the mask. And people do that without thinking, and that's the problem. That when they get sick, they carry the virus to the unvaccinated personnel, and those unvaccinated personnel end up in the hospital. And we really have to go back and to the really basic of using your mask and stay away from people that have some cough, congestion, and fever.
Doc, first day of school is tomorrow. Just in the comments on a few different articles we posted, people were talking about this surge and the Delta variant. I know that a parent had said you were in the DOE Zoom last night. So just, I guess if you could, what's your message to those parents who might be a little worried about kids going to school in the middle of this surge?
The school and public health have put a lot of plans together, and is kind of try to do a layer approach there to try to prevent any incidents in the school as best as possible. So I think right now we just need to make sure that the staff, the students are using their masks in the school. Okay, that's really mandatory. You cannot take your mask off unless you have a medical reason not to. And also there's some social distance in the common area that are implemented. So that should kind of prevent an infection in the school. Doesn't matter how much prevention they put in there, we will anticipate that there's a few positive will come back in the first 2 or 3 weeks or so. But hopefully we don't see any. But like I said, we're gonna hold a vaccination clinic for the GDOE staff and also for the student and the parents this coming Saturday to try to comply with the governor mandate for the vaccine for all the Gong Guam agencies. So I encourage the GDOE staff and the parents to bring the student this Saturday. I think it's going to be a teen high school gym. to get vaccinated. So at least they got the first dose in, so they can be protected. So, but we should go face to face with the school as of tomorrow. Because I think kids really need to be in school to be because last year is just really set them back a whole lot.
I know you talked about that layered approach and, the mandate for kids to wear the mask at school and social distance and all, but I'm still kind of trying to understand then why is it that when kids get on the school bus, there's no social distancing. It's only just get on the bus and go to school and wear a mask.
So in the bus, they're supposed to kind of group kids in a group, and
Right.
especially the family sit together. They supposed to be all using their mask, and the window are open. So as long as you have a lot of fresh air going through, the exposure is very minimal if all the kids have the mask on. So just like if you are on the airplane go from Honolulu to Guam, you're gonna sit next to each other, but you're gonna have your mask on the whole time. So that exposure is minimal. I think it's still you don't have to be social distance in the bus as long as you have your mask on. And kids, they especially the 8th to 9th grade to below, they their lung capacity is very small. So the risk of them spread the infection is very, very small. And again, ask the parents if your kids are sick, don't send them to school. Go get them tested for prevention, but don't send them to school if they're sick. And that's where the responsibility of the parents and respect for other students coming from. So everyone had to play a big part in this one, Sabrina.
Are you still anticipating the hospital numbers to surge?
Right now I know we have 9. So
9?
And I think the number is 9. I think you have 4 at GMH and I think maybe 5 at GMC. But that's the last I heard. They might discharge some people. Anticipate that the hospital number will go up in the admission. The key part is that you see a lot of positive out there. I'm not too worried about the vaccinated people. I'm worried about the unvaccinated people that get exposed to the virus and end up in the hospital. That's what we worry about. So again, it's back to the basic. Wearing your mask and
wash your hands.
Wash your hands and social distance. And right now, I tell you, there's some cluster there that really the cluster is in the gathering. I tell you, when you have a gathering over 50 or 100 people. And mixture within the vaccinated and unvaccinated personnel, you're going to have a cluster coming out of every gathering. So I'm not quite sure if you're a host for an event and you have more than 100 people there, you got to feel responsible somehow and make sure that all the guests that attend your event don't end up getting sick or end up in the hospital. So that's something that we really ask people to really pay attention to and get into those ballroom and take your mask off. You really is kind of put yourself at risk a whole lot.
All right. Is the Physicians Advisory Group having discussions or planning to recommend to the governor that she reimpose any sort of restrictions? Limits?
We always say that we have to watch the hospital admission, right? I mean, if you have a lot of people, a large percentage of people vaccinated, and you have a lot of positive, we're not too worried about those positive. If you have those people are fully vaccinated, but them positive are high, yes, we worry about the hospital. And again, everyone knows our trigger point is 10 admission to the hospital. You know, when you can every admission to the hospital that involve COVID require enormous amount of manpower to take care of those patients. And when you do that, you kind of take away the manpower to take care of the other people that get admitted for stroke, heart attack, and other chronic illness complications. So when you do that, you really burden the hospital a whole lot. So at the number 10, yes, she might put back some restriction if we have a high rate of admission to the hospital. And that's something that, I don't think the PAC like that idea very much, but we have to support that because, again, if our people are not be careful on the basic thing that we should do, then, the rest of the island will go backwards. So I really, really encourage people to really pay attention and the 4W and stay away from people that are sick.
Yeah. Okay. So the JIC report said that there were 7 hospitalizations. You're saying there's 9, as far as you know. That's the latest numbers you got, and the trigger point is 10. When we're going to have some really serious discussions on whether the governor should be implementing or re-implementing restrictions.
Yes. Sabrina, when we have 20, 30, 40 positive in one day, you gotta know the artists, some of those people, because remember when you turn positive, you have a week or so before you can end up in the hospital. So you have to look at this number very carefully. Like I said, I think yesterday the number is 44 on Monday, right? And 16 of them are fully vaccinated, and the rest of the 44, out of 16 there that unvaccinated. So those unvaccinated population, that's what we are worried about. I'm not too worried about the fully vaccinated people that turn positive.
Yeah. Do you have any sort of breakdown of those positives other than the vaccinated, like the age groups, if they were elderly, were they children or anything like that?
Yeah, but that's something that I'm the PAC, and I will ask again. That is very important for public health to release those numbers to the people. It helps the people understand of what's going on. I think it will help the people in curb whatever habit they do right now to protect themselves, protect their family. So it's very important that we need to release those numbers of the what the age group that are turned positive, are they fully vaccinated, are they partially vaccinated, or they unvaccinated that turned positive, and including the hospitalization. You need to know who fully vaccinated, who's not vaccinated. So I think that those numbers will help our people and adjust their daily routine and the exposure risk to other people. So it's very important. I want to continue to push that to be released on the JIC, because I think that if you just say 44 positive, it doesn't mean much. You really need to let people know, every detail of those positive. So I'm going to continue to push for them to release that in the JIC in a different ways. Okay.
Thanks, Doc. We had a comment here. Is the doctor concerned that there's no quarantine in place for travelers? Only asking because he mentioned last night that he has a patient who recently came home from Hawaii and ended up positive for COVID. Is he concerned that there might be a possibility it could be one of the Delta variants?
Yes, we're very much concerned, and that's why, we still require PCR for unvaccinated people to come in. It's a very important step that you identify that you're negative before you board that plane. If you don't have that pre-arrival PCR requirement, then you take quite a bit of risk. So you won't catch 100%, but at least you catch quite a few before they come in. Now, the part about the quarantine and without the quarantine is that the purpose of the vaccination and that 80% is try to minimize the impact of any virus to come on the island and infect the people that vaccinated. As you can see, if we don't have 80% of our people vaccinated right now, I guarantee you that hospital admission will be much, much higher. So it does its purpose right now for the vaccination, but we still are highly encouraged for the rest of the 20% to come in and get the vaccination. If we can get to higher than 80%, the higher we get, the less chance that anyone going to burden the hospital for admission. So yes, we're concerned about the quarantine, but at a certain point, there's a balance there that we have to use our judgment to make sure that our island economy are open up. People are more to travel back and forth to make more convenient for them. But again, we will continue to push for the vaccination. I think that with the mandate that coming through with the government, and we're going to push the private sector and mandate the vaccine on the private sector to provide a safety in the workplace. I think lots of big companies now are doing the same thing. There's quite a few more private companies that approach us for to help them, to vaccination, because they're going to mandate their workplace. I know AMC and GMC are already done that already, but I think I have a phone call from several companies already that would like to mandate and help and access to help them vaccinate their employee. So that will help a whole lot. If the majority of don't want to vaccinate some private or reduce some requirement, we will get that 85-90% vaccination on island, and we'll be a much safer place to be.
And also, I think, Doc, what's important is that for people that are getting the vaccine, because I was kind of looking at the numbers on people who got their first vaccine, but then there's like thousands that didn't go back to get their second shot. So I think that when we ask people to get vaccinated, to make sure that you're getting fully vaccinated, that you complete the 2-dose series.
We have about 3,000 to 4,000 people that missed the second dose, and I always them in this. It's easy to come in, take your time, especially now that we worry about the Delta virus coming in. That get yourself fully vaccinated, but get the second dose. The Delta virus is somewhat a different beast, and now that we have the Delta plus, is another variant that kind of bind to the lung tissue a whole lot more than the Delta, and that will be a problem in the future if we don't watch out. But the vaccine does cover for it, so I know it's go from 94-95% down to 80%, but still 80% is a lot better than 0%.
All right, thanks a lot, Dr. Hoa.
You're welcome. But Sabrina, first, Jason, just again, we just ask people to really go back, and Chris, you can yell back to the basic 4W, and we just need to make sure that we respect each other, and let's work together and get this number to come back down again. Okay?
Thank you, Doc.
Thanks, Doc.
You got it.
You're welcome. Have a good day, guys.
You too, my friend. It's 8:33. We continue now with our KUAM newscast brought to you by Pacific Points with Sabrina Salas.